Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. Okay, welcome back. It is March 18th, and latest updates with the coronavirus or COVID-19. We'll have messages from the WHO, Justin Trudeau, and from the BC Minister of Safety. After, of course, yesterday, Dr. Henry and Adrian Dix declared a public health state of emergency. We have entered into British Columbia as a provincial state of emergency. So more resources will be opened up, and it enables the province to act quicker on issues and things like that. In the past few years, this is the first time that there has been a provincial state of emergency announced. If you remember with the wildfire situations just a couple years ago, that the same exact thing. And the hope, when you actually listen to the minister talk, the hope is that, of course, this will bring us together closer as a community so that we can work together to get through this pandemic, COVID-19. Okay, so let's work with the first thing is the federal government with Justin Trudeau, and we'll be right back with that.
Merci d'être des nôtres. Before we get into things, I have some news to share regarding the Canada-US border. Over the past few days, I've spoken to President Trump about what we can do to slow the spread of COVID-19. Deputy Prime Minister Freeland has been in touch with Vice President Pence and Secretary Pompeo. I just spoke to President Trump again this morning, and we have agreed that both Canada and the United States will temporarily restrict all non-essential travel across the Canada-US border. Je viens de parler au président Trump.
I just spoke to President Trump, and we agreed that Canada and the United States will temporarily restrict all non-essential travel over the border.
Travelers will no longer be permitted to cross the border for recreation and tourism. In both our countries, we're encouraging people to stay home. We're telling our citizens not to visit their neighbors if they don't absolutely have to. Well, this collaborative and reciprocal measure is an extension of that prudent approach. I want to be clear, though, that essential travel will continue. Our governments recognize that it is critical that we preserve supply chains between both countries. These supply chains ensure that food, fuel, and life-saving medicines reach people on both sides of the border. Supply chains, including trucking, will not be affected by this new measure. Canadians and Americans cross the border every day to do essential work or for other urgent reasons. That will not be impacted. Ces jours-ci,
These days, all Canadians are feeling the consequences of COVID-19. To ensure your safety, we are recommending to everyone that they work from home, to avoid public spaces, to buy only what they need at the grocery store, and especially to be kind and empathetic towards those around you. We must all do our share to protect our health and those of the people around me.
Is forcing us all to change our ways, and for many people, that's a huge adjustment. If you work in a restaurant, drive a cab, organize events, or freelance to pay your bills, working from home is not so simple. Just like if you work in the oil and gas sector or the tourism and seafood industries, you're looking at the uncertainty in the global economy and probably wondering not only how long this is going to last, but how long your savings are going to last. No matter who you are or what you do, this is a time where you should be focused on your health and that of your neighbors. Not whether you're going to lose your job. Not whether you're going to run out of money for things like groceries and medication. Last week, we announced a whole range of measures to protect jobs, small businesses, and the economy, from waiving the waiting period for employment insurance sickness benefits to kick in, to increasing support for employers and businesses. We introduced special measures under the work sharing program to help employers who fall on hard times during COVID-19. And if your business faces a cash crunch, we will help you bridge to better Today, we've announced $27 billion in direct support to Canadian workers and businesses, plus $55 billion to meet liquidity needs of Canadian businesses and households to help stabilize the economy through tax deferrals. Economic measures will ensure that our economy rebounds after this. And while we are taking a significant step today to help families get through these challenging times, our government is prepared to do more. But whether we're talking about economic, travel, or health measures, collaboration and coordination remains essential. Our team is in constant communication with our colleagues in the provinces and territories, as well as Indigenous leaders and communities, to ensure that we have a coordinated, Canada-wide approach so we face this and recover from this together. We're also working with our international counterparts. Over the last number of days, I've spoken with leaders from around the world, including with fellow G7 leaders. Working together is how we'll get through this, as families, as a community, as a country. Like many of you, over the past few days, I've seen stories of people doing just that. Of people donating money to food banks to help those in need. Of friends setting up online groups to chat. Of retired nurses and doctors stepping up to health. Of young people giving a hand to elderly neighbors by dropping off some extra groceries at their door. I have to tell you, it gives me a lot of hope. I want to close by recognizing everyone on the front lines who's doing an incredible job of keeping Canadians safe and healthy. Grocers keeping their shelves full and our families fed. Postal workers helping us stay home. Pharmacists filling our prescriptions. Healthcare professionals caring for our most vulnerable. Public health officials and first responders looking out for our safety. I know it's a hard time, but that's exactly why we need to keep supporting each other. Our government is here for you, and your fellow Canadians are here for you too. Merci. Thank you, everyone. Just before we get to questions, I'm supposed to model healthy behavior. I'm going to go grab my coat, and I'll be right back.
Okay, next up is Mike Farnworth, BC Minister of Safety, and he is about to announce that in this clip that they are declaring a provincial state of emergency, and as I said, that it will open doors to and finances to much needed resources to help the residents of British Columbia get through this emergency that is COVID-19, and help all the other levels of government provide care and services that are going to be needed to really help, as they keep saying, curb the curve, bring the curve down, so that people can be healthy and safe, and hopefully it will get everybody back to work again, because there have been a number of closures, restaurant closures, and things like that have been happening, not just across the province, across the country, but also around the world. And so let's get to Mike Farnworth and his statement about how this state of emergency is actually going to work for British Columbia.
Hello, everyone. I'd like to, as I begin, to acknowledge that we're gathered on the territory of the Musqueam, Tsleil-Waututh, and Squamish peoples. As you know, I'm Mike Farnworth, the Minister of Public Safety and Minister responsible for Emergency Management, British Columbia. For the last several weeks, Provincial Health Officer Dr. Bonnie Henry and Minister of Health Adrian Dix have been working tirelessly to prevent the spread of COVID-19. Dr. Henry has given us important instructions on how we can flatten the curve and keep people safe and healthy. Yesterday's declaration of a public health emergency facilitates even faster response to this rapidly evolving situation. and gives our public health officer the ability to make swift decisions to protect British Columbians. COVID-19 is impacting all of us, touching our lives and our economy, and I know it's been hard on people. I want to assure British Columbians that our government is doing everything possible to mitigate the risk for people in our province. But we are facing daily, shifting challenges, as is everyone in this difficult time. At this juncture, we need to ensure that we will continue to have the means to coordinate our response across government, across industry, and that we have the tools available to protect the most vulnerable. That is why, today, based on the recommendations of BC's health and emergency management officials, and following Dr. Bonnie Henry's declaration of a public health emergency, I am declaring a provincial state of emergency to support our provincial health officer and Minister of Health in swift and powerful response to the COVID-19 pandemic. This declaration will make sure federal, provincial, and local resources are delivered in a joint, coordinated way to protect the people of our province. This is an all-hands-on-deck approach. The declaration also includes the means to secure critical supply chains, to ensure people have access to essential goods and services, and that any infrastructure necessary to support the response to COVID-19 is readily available. Yesterday, you heard the Premier and Minister of Finance outline our plan to support people and to protect workers. As House Leader, I'm working to resume the Legislature to complete this urgent government business to expedite our response to COVID-19 and the key decisions that will need to be made in the coming days to give immediate relief to the people and businesses in our province. I want to take this opportunity to thank Opposition House Leader Mary Polak and Green Party House Leader Sonia Furstenau for their cooperation. Together, we have agreed to resume the Legislature on Monday with a reduced number of members to pass important legislation that will ensure the continuity of government and provide important employment supports to people in our province. Our government will do whatever is necessary to protect and support British Columbians and communities, and we will use any and all resources available to keep people safe. These are extraordinary times, and I want to acknowledge and express sincere appreciation for the efforts of all involved in this emergency. To the essential service workers, to the health professionals, to the grocery clerks who continue to support us all. As Dr. Henry has said, now is the time to be kind, be calm, and most of all to be safe. We all have a role in protecting public safety in our communities. Provincial states of emergency were previously declared in 2017 and 2018 in response to wildfires. The way communities came together during those events was nothing short of extraordinary. We are now asking all people in this province for their support again. Follow the advice of the public health officer. Be vigilant about your hand hygiene. Maintain social or physical distancing and stay home if you're sick. We are going to get through this together. All of us. Thank you.
Thank you, Minister. We'll now take questions, and we'll only take one question at one time. We'll take questions from the room first and then go to the phones.
Next up is Dr. Tedros with the World Health Organization, WHO, and he's making an announcement about ending the emergency outbreak in DRC with Ebola, and he's going to give us updates on what is going on globally with the COVID-19 situation and the pandemic that is going on around the world. So let's listen to that right now.
And good afternoon, everybody. It's now more than a month since the last case of Ebola in DRC. If it stays that way, the outbreak will be declared over in less than a month's time. We would like to thank all our partners for their solidarity in staying the course in the service of the people of DRC, and my special appreciation especially to the government and people of the Democratic Republic of Congo. That same spirit of solidarity must be at the center of our efforts to defeat COVID-19. More than 200,000 cases of COVID-19 have been reported to WHO, and more than 8,000 people have lost their lives. And more than 80% of all cases are from two regions, the Western Pacific and Europe. We know that many countries now face escalating epidemics and are feeling overwhelmed. We hear you. We know the tremendous difficulties you face and the enormous burden you are under. We understand the heart-wrenching choices you are having to make. We understand that different countries and communities are in different situations with different levels of transmission. Every day, WHO is talking to ministers of health, heads of states, health workers, hospital managers, industry leaders, CEOs, and more to help them prepare and prioritize according to their specific situation. Don't assume your community won't be affected. Prepare as if it will be. Don't assume you won't be infected. Prepare as if you will be. But there is hope. There are many things that all countries can do. Physical distancing measures like canceling sporting events, concerts and other large gatherings can help to slow transmission of the virus. They can reduce the burden on the health system, and they can help to make epidemics manageable, allowing targeted and focused measures. But to suppress and control the epidemics, countries must isolate, test, treat, and trace. If they don't, transmission chains can continue at a low level, then resurge once physical distancing measures are lifted. WHO continues to recommend that isolating, testing, and treating every suspected case and tracing every contact must be the backbone of the response in every country. This is the best hope of preventing widespread community transmission. Most countries with sporadic cases or clusters of cases are still in the position to do this. Many countries are listening to our call and finding solutions to increase their ability to implement the full package of measures that have turned the tide in several countries. But we know that some countries are experiencing intense epidemics with extensive community transmission. We understand the effort required to suppress transmission in these situations, but it can be done. A month ago, the Republic of Korea was faced with accelerating community transmission, but it didn't surrender. It educated, empowered, and engaged communities. It developed an innovative testing strategy and expanded lab capacity. It rationed the use of masks. It did exhaustive contact tracing and testing in selected areas. And it isolated suspected cases in these designated facilities rather than hospitals or at home. As a result, cases have been declining for weeks. At the peak, there were more than 800 cases, and yesterday the report was only 90 cases. WHO is working in solidarity with other countries with community transmission to apply the lessons learned in Korea and elsewhere and adapt them to the local context. Likewise, WHO continues to recommend that wherever possible, confirmed mild cases should be isolated in health facilities where trained professionals can provide good medical care and prevent clinical progression and onward transmission. If that's not possible, countries can use community facilities to isolate and care for mild cases and refer them for specialized care quickly if needed. If health facilities are at risk of being overwhelmed, people with mild disease can be cared for at home. Although this is not the ideal situation, WHO has advice on our website for how home care can be provided as safely as possible. WHO continues to call on all countries to implement a comprehensive approach with the aim of slowing down transmission and flattening the curve. This approach is saving lives and buying time for the development of vaccines and treatments. As you know, the first vaccine trial has begun just 60 days after the genetic sequence of the virus was shared by China. This is an incredible achievement. We commend the researchers around the world who have come together to systematically evaluate experimental therapeutics. Multiple small trials with different methodologies may not give us the clear, strong evidence we need about which treatments help to save lives. WHO and its partners are therefore organizing a study in many countries in which some of these untested treatments are compared with each other. This large international study is designed to generate the robust data we need to show which treatments are the most effective. We have called this study the Solidarity Trial. The Solidarity Trial provides simplified procedures to enable even hospitals that have been overloaded to participate. Many countries have already confirmed that they will join the Solidarity Trial. And these countries are Argentina, Bahrain, Canada, France, Iran, Norway, South Africa, Spain, Switzerland, and Thailand. And I trust many more will join. I continue to be inspired by the many demonstrations of solidarity from all over the world. The COVID-19 Solidarity Response Fund has now raised more than $43 million from more than 173,000 individuals and organizations. Few days since we launched it. I would especially like to thank FIFA for its contribution of $10 million. This and other efforts give me hope that together we can and will prevail. This virus is presenting us with an unprecedented threat, but it's also an unprecedented opportunity to come together as one against a common enemy, an enemy against humanity. I thank you.
Thank you very much, Dr. Tedros.
Okay, we keep hearing about this curve and they're trying to lower the curve, and they're trying to, and it's all what may seem very vague to a lot of people out there. What this curve actually is, and what it means, how they're measuring what it means to have a pandemic, and what it means, why there's so much urgency around curbing our behaviors so that we lower the rate of infection, and what this actually means. So I found this video or this recording about what all that means when we're talking about exponential growth versus a pandemic. So I'm going to play that for you right now, and hopefully that'll help you understand why it is so important for us to actually curb our behaviors and follow the guidelines that the WHO and local government is actually putting in front of us. So let's get to that right now.
Stay like this for a long time until one day a few people you know are sick. And suddenly a few days later it will seem like everyone is sick, and it will feel like it happened instantly. Everything looks fine until it isn't fine. This is the paradox of pandemics, and it's why with an outbreak like COVID-19, you hear health officials calling for huge, drastic, and rapid responses in the early days when infection numbers are still relatively small. Some people worry that these actions are overreactions. Sports teams playing to empty stadiums or not playing at all, canceling huge gatherings and festivals, temporarily closing schools and offices, telling people to avoid personal contact. Media sensationalism. But this way of thinking fails to appreciate how disease outbreaks work. It was really never fine to begin with, but we don't notice until it's too late. Hey smart people, Joe here. How bad will the coronavirus outbreak get? That's what we all want to know, and the answer is in one of these curves. This is what a rapid global pandemic looks like. Little to nothing to slow the number of new infections means a lot of people sick in a short amount of time. A slower global pandemic looks like this. The rate of new cases is lowered and they're spread out over a longer period of time. And which one of these paths that we end up on is important because of this line. It represents the capacity of our healthcare system, the number of beds, doctors, respirators, and everything else. What experts fear is a sudden explosion like this, overwhelming this capacity. And what's really interesting here is that even if these two curves represent the same total number of people that eventually get infected, in the rapid outbreak scenario, more people will die because there won't be enough hospital beds or ventilators to keep them alive. This is a strange idea, that even if the same number of people eventually get sick in the end, even without a vaccine or a cure, taking drastic action before we see things get bad, that will save lives all on its own. What we're doing isn't overreacting. It's exactly what the science of epidemics tells us will work. And that's counterintuitive, because our intuition doesn't really get exponential growth. Instead of thinking about viruses, let's say you have a pond. And on the pond is a single lily pad. This type of lily pad reproduces once a day. So on day 2, you have 2 lily pads. On day 3, you have 4, etc. If it takes the lily pads 60 days to cover the pond completely, how long will it take for the pond to be covered halfway? The answer is 59 days. The area covered doubles from half to the whole pond on the last day. I bet some of you knew that though, because you're pretty smart. But on what day do the lily pads cover a mere 1% of the pond? Well, surprisingly, that doesn't happen until day 54. The pond is basically empty until it's very suddenly not empty. We go from covering less than 1% to covering the whole pond in just the final 7 days. This is exponential growth, and it's how pandemics work. We multiply today by some constant to get the value for the next day. The time doesn't have to be days, but that's helpful to use for something like lily pads. Our constant was 2, or COVID-19. Starting in mid-February, we've seen between 1.1 and 1.4 times more cases each day. A number over 1 tells us every day we're seeing more new cases than the day before. You can see the number of total cases starts to add up really fast. Exponential growth can be scary, but obviously this can't go on forever and fill the known universe with viruses for a few reasons. The virus will either infect everybody, like our lilies filling up the pond, or what actually happens is the virus stops finding people to infect, either by running into people who are already sick, or we isolate people who are sick, or thanks to something like a vaccine, spreading resistance in the population. But over time, the growth rate will naturally slow down, and we end up with a curve for the total number of cases that looks like this. This is called logistic growth, and we call this curve a sigmoid, which is a weird name, but luckily it starts with S, which also happens to be the shape of the curve. While I was working on this, Grant from 3 Blue 1 Brown released a really good video digging into more of the math behind why and how this all changes. And he's definitely my go-to when it comes to math, so I'll put a link down below so you can watch that later. Now remember that the height of any point on our S-curve tells us how many total cases the outbreak has caused as of that day. But if we take the slope at that point, that shows how many new cases that day, which makes sense. Not many new cases early on, then a whole lot each day, and then not many new cases again as the virus dies out or goes quiet. If you've taken calculus and worked out derivatives before, then you may see where I'm going here. Plotting the different slopes along our S-shaped curve, we get this. This is what health officials are worried could overwhelm our healthcare system. But luckily, we can make it look like this instead, if we change how our S-curve looks. And how we do that is by lowering the constant we multiply from day to day in our exponential growth. The really important thing here is for a virus that humans have never encountered before, like the one that's causing COVID-19, no one's immune to it. The only way to lower the growth rate isn't medicine or anything like that. It's to slow down those infections and keep them from happening in the first place. A real outbreak plays out like this. You have a bucket of infectious people, I, and you have a bucket of people who haven't gotten sick yet, S. The I bucket is tied to the S bucket so that the more full I is, the faster S empties into it. But people are also getting better all the time, so the I bucket has a hole in it that empties into a bucket R for recovered people at some constant rate. So if we can lower how fast S empties into I through some drastic action, I will empty out into R and will stop emptying S. If our bucket of infectious people is empty, we starve the virus out. So even if we somehow did nothing else to stop a disease outbreak or pandemic, and the same total number of people get infected in the end, it is so important to slow down how many new cases we see every day, to flatten the curve, and keep a pandemic from overwhelming healthcare. In 1918, in the early days of the worst influenza pandemic in history, the city of Philadelphia ignored warnings and held a parade attended by 200,000 people. 3 days later, every bed in Philadelphia's hospitals was full, and 4,500 people died within a week. At the same time, St. Louis, 2 days after detecting the first cases, closed schools, playgrounds, even churches. Work shifts were changed. Public gatherings of more than 20 people were banned. And this was the result. A tale of two cities. That's why officials are calling for such drastic actions so early on, canceling events and school and everything else, before most of us actually know anyone who's sick. Because with something like this, everything looks fine until it isn't fine. And if we wait until it's our turn to get sick, it's too late. Stay curious and wash your hands. We'll be talking more about that soon. And as
Okay, so there we have a brief explanation about what it means to flatten the curve. So if we take drastic measures early, and as our government is doing right now, then hopefully the curve will flatten and there won't be much of a strain on our healthcare officials. So there we have it. All right. So I want to end on what of course would be a happy note, and there is a group of students down in Las Vegas, being led by a young lady by the name of Jade Powell, and they are helping people who are shut in or have to isolate get groceries and help them keep essential supplies in their homes so that they can weather this storm of COVID-19. So let's play that one for you next, okay?
Feel long lines and empty shelves across the valley.
The problem we're facing now is when you go to the store, those items aren't even on the shelves to be able to buy. So I want to move these over here, Jade.
Jade Powell isn't picking all of this up for herself.
Bottled water, milks, canned goods, soups.
The pre-med student at UNR is launching a program called Shopping Angels.
It's been, something that I've been really focused on and brainstorming pretty intensely for the last 2 days.
No delivery fees, no extra costs. Powell just wants to help those who can't leave their homes.
When you coordinate with us, we'll give you the name of the volunteer who's offering to pick up your stuff, and you'll put them on your pickup order so that we can go out and get those groceries to you. Going to one store could be an all-day affair for an elderly person. You know, they don't have a lot of money to spend on gas and, you know, a lot of energy to drive around to all different stores only to find out that they can't even get the basic supplies that they need to last them for a couple weeks. We've gotten toilet paper, paper towels, cleaning supplies.
Anything you might need to get you through a couple of weeks. Powell already has more than 36 college students in both Reno and Las Vegas ready to help.
These boxes we're going to use for storing some of the stuff in so we can organize.
Powell says volunteers will be required to wear masks and gloves while picking up groceries.
So we're going to have this one.
And when they make their deliveries,
we also want our volunteers to not go inside the homes.
Powell has the supplies and the staff. She hopes seniors or their caretakers will now reach out.
So I think having something like this in place, ready to go, would definitely be able to benefit for future outbreaks.
Thank you for listening today, and stay safe. Help out your neighbor if you're healthy. If you're sick, please do stay indoors. Get the rest and care that you need to get better. Until the next time, we will talk to you later with more on policy and rights. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.